Hey, ladies and gentlemen, I have 9 o'clock on my computer. I call this Sawyer County Public Safety Committee meeting to order. Can we have a roll call?
Ron Buckholz.
Present.
Mark Helwig.
Yep.
Ed Peters.
Yes.
Jason Weaver.
Present.
Thank
Yeah.
you. Marshall Savitsky.
Here.
You have a quorum.
Okay, number 3, Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, number 4, certification of compliance with open meetings law, Madam Clerk.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Okay, number 5, meeting agenda has been presented. Number 6, we're gonna go with staff recognition. Mr. Fremmel, turn it over to you.
Hello. Today we are going to be recognizing one of my EMTs. To present an award from Essentia Duluth is Dr. Mulvan with the STEMI program, Heart Attack program. He's the one that gets me all my data for when we send people up to Duluth, and we've been working really close with him. I love our relationship and the training that's coming of it. And so here he is to present an award to Bill Weiner.
Awesome. Thank you, John. And sorry. Yep, my name is Richard Mulvane. I'm actually a clinical pharmacist by trade, specializing in cardiology, and somehow I ended up becoming the heart attack program manager for Essentia. And I've been working real hard for over 16 years now, developing the heart attack pathways protocols for Minnesota and Northwest Wisconsin. And we work super hard to make sure that everyone in the chain of touching that patient, the 911 calls to, treating them, recognizing the heart attack and getting them hopefully to the hospital with the cath lab where we can stop that heart attack in the tracks. And it takes a village, literally. Every year we recognize outstanding care by EMS, and I don't want to go into too much details, but there's more reasons why we're giving this award to Bill, but there's his role, particularly in a case that was surrounding the Birkebeiner ski race, the care that he helped provide. And there's so many heroes. There's so many, people here that were also involved in the rescue there, but just the professionalism. And it's one thing to revive someone, but it's another thing to keep them alive and get them where they need to go. And Bill, he just did a great job recognizing what needed to be done. I won't go into the details. If you want to ask later, I will go into it. But just big picture, he embodies the spirit of what we'd love to see. He's obviously dedicated to his profession. The profession won't let go of him, it sounds like. And he's given a lot of his time teaching CPR and other things. And so with that, I'm very proud on behalf of Essentia Health, St. Mary's Medical Center, to present Bill with our annual STEMI Award of Excellence. So thank you, Bill.
Thank you.
Thank you, guys.
Thank you. You can run away. So we also have one more thing that we want to talk about. It's not an award that's coming right now, but on October 17th, down in Madison, Jim Onerheim is going to be receiving a EMS Person of the Year for Ward 87. So not only did we get recognized by our hard work and our training that we've been paying off, the state is even looking at us. And I hope that this continues. I have many people that deserve an award that are dedicated to the health and the well-being of everybody in Sawyer County. Thank you.
Thank you, John. I would just like to say something from myself and on behalf of this committee, that we appreciate what you guys do out there.
for the Sawyer County residents. You work hard and we appreciate that. Thank you very much for all you do. Okay. Number 7, public comment. Is there anybody out there that wants to speak before the committee? Lynn, does anybody have any hands up? Okay. All right, number 8, consideration of the minutes from the previous meeting.
Make a motion to approve.
Okay. We have a motion by Mr. Helwig and a second by Mr. Peters to approve the previous minutes. All in favor, say aye. Aye. All opposed. Motion carries. Okay, number 9, Circuit Court, Judge's Report. Marge was just in here telling me that all 3 courtrooms are going today. They're very busy, so we will not hear from the judge or any of the judges. Lynn, did you ever hear back on that email you sent? Oh, okay. 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 All right. All right. Thank you. And number B, courthouse remodel update, Andy.
I don't have any updates today, different than last month.
Okay. All right. Number 10, clerk of court's office reports. Marge won't be here because she's very busy today, but she did give us a report. Did everyone have a chance to look it over? Any questions? If not, we'll move on to number 11, Sheriff's Department report, Communication Center report.
Thank you. Not much to add other than our newest full-time hire did finish her final phase on Monday, and she will be full-time on her own starting Saturday, her first shift.
Okay. Any questions? All right. Number B, patrol report. Lieutenant's not here. Sheriff, are you doing that?
Yes, I'll go ahead and present in the lieutenant's absence due to some vacation time.
Okay.
Well-deserved vacation.
Well-deserved, yes.
We have seen a decrease in number of calls going into the fall from the busy summer. Calls for September totaled 782. We are holding at 4 fatalities. Hopefully we do not have any more of those. Always a tragedy. We did, our deputies with the Hayward City Police and other agencies assisted in the 40th Chequamegon, used to be called the Fat Tire Race from Hayward to Cable. Everything went pretty well. And next weekend, or this coming weekend here, is going to be the 45th annual Stone Lake Cranberry Fest this Saturday. So that's always a big event with many people there, enough people that it takes our cell phone coverage down, at least in the Stone Lake area. And tomorrow, Mike Mayer is going to graduate from the police academy as a new recruit. So we will be attending his graduation tomorrow. He has worked several years in the jail for us on a part-time basis while obtaining his associate's degree, and has done an outstanding job for us. So we're excited to have him on board as a certified officer as well. And he's going to stay with us part-time and be a future candidate full-time, hopefully.
Good deal.
Sheriff, is he gonna continue in the jail or is he going over to the road?
He will start his training on the road here. We do have a couple jailers that are going to go to jail school here. So he's going to help us here and there fill those voids, but otherwise he's going to be an FTO for the road, and we'll be working on the road primarily. But with his experience in the jail, it does benefit the agency more.
Yep.
Oh, yeah.
He's very flexible, and he's one of those guys, He's here for the organization.
Okay. That all you got, Sheriff?
For patrol, yes.
Okay, any questions for the sheriff? Mr. Weaver, you have any questions? Okay. All right, number C, jail report. Who's gonna do that? Chief? Okay.
Lieutenant Oler apologizes. He's attending the annual jail administrators conference this week, so he's down in Green Bay. Any questions on his report? As you can see, the average daily population is down from what it was last year at this time, so that's good news. The Huber program is starting to move forward a little bit, so we now have 5 working Hubers, and that's going well. And the other good news is we're not housing anybody out of county.
On here, it says there's 2 out of county.
Well, those are,
Old ones?
they're,
Well, the one, okay. But then I see there's a one in Washburn.
they're moved out of our population report because Washburn has taken them to do something with them, but they will be coming back to us.
Oh,
So
okay,
They're just
okay.
moved out that way.
Okay.
They're not technically being housed there. We're not paying for that housing there.
Oh, okay, all right. Okay. Anybody have any questions for Chief on the jail report? Mr. Weaver, got any questions?
No, sir.
Okay, thank you. All right, number D, communication specialist report. Mr. Crook on there? Okay. All right, Town of Draper, number E, Town of Draper communication budget update. Where are we at with that? Anybody got any answers for that? It was asked to be brought back to this committee.
I know we've fulfilled some records requests for the town of Draper. I think the sheriff had the last communication with them.
Okay.
We have not had any other discussions since, well, I'm trying to remember when,
I had some communication with the fire department at our fire association meeting
Yeah.
last month. And just informed them that we're moving forward with the RFQ.
Okay, all right. Okay, thank you, Sheriff. All right, number F, code enforcement specialist, Brandon. Good to see you.
Good to see you. So pretty much everything this month is animal control centric. We're starting to build up for the 2024 licensing season with the help of the clerk's office. Already starting to do the preliminary planning for the next rabies clinic, which is going to be in end of March next year. We're going to have a little blurb for the license sellers so that they can tell anyone who's buying a license about it. Locations planned same as usual, City of Hayward, Village of Winter. We've been working on the emergency planning for pets. We have a big binder that has all the protocols already, but a lot of it doesn't have a way to execute anything. So we've been working on that, making sure everything's set up. So if there's another incident that requires emergency housing, we have something that we can follow. Admissions to the pound have been steady. Pretty much everyone in the area right now is full up. Humane Society is at capacity. I believe the last I checked, LCO is at capacity. We aren't yet. We came close to it last week. So I don't know if it's people dumping their dogs or what, but that would be a guess, given how many dogs I brought over to the Humane Society instead of releasing to owners. In August, we saw a rise in bite cases compared to the rest of the year. Noise complaints have been the other big issue. Some of them stemming from hunting dogs, some of them just your typical residential dog. On top of that, the new software that I have been working with over the last month and a half, 2 months, has been very good. Helps me track the calls with more accuracy, and also allows for images and more detailed information on pets that we do get in. Not only from a record keeping standpoint, but then just, I can't remember every dog we get in. This way, when we get repeat offenders, it's a lot easier to just look that up and see who belongs to who and if we've had them before. And then relevant reports are below.
So Brandon, all these pets that you're picking up, what happens to them if nobody claims?
So we typically hold them for 7 days. After that 7 days is up, they go over to the Humane Society.
To be adopted up?
Yeah.
Okay.
Right now with how everyone's at capacity, I know I have 2 that were supposed to go out today. They're not going out today. I don't know when the Humane Society is going to be able to take them.
Okay.
So you hold them until there's room over there? Or?
At this point, yes.
And I suppose a lot of these that you're picking up don't have collars or anything like that.
It's very rare that I
Fairly rare.
get a dog in with a collar, and then like there was a dog that came in on Tuesday that had a collar and a tag, but the tag was from 2015 or 2016.
Oh, sure. Okay.
So none of the information that we had was accurate. That one went home,
Okay.
but that's one of the main things that I need to try and get the information out. I've had people report that townships are telling them we can't track the tags by the numbers. That's all just for show. I don't know where they got that idea, but
Yeah.
it's not the truth. And then our ordinances and the state statutes require that every dog that's off the owner's property have a collar with a tag on it.
Right. Any questions for Brandon? Okay, number G, dog license procedure change update.
I don't have that ready for the committee yet.
Okay, thanks, Andy. All right, number 12, emergency management. Nicole,
Thank you. September 25th, we had a hazmat tabletop, which was held at the Hayward Area Memorial Hospital, which is now not that anymore. Remember the name of it, but we're planning on a functional drill to happen on October 25th, rain or shine. Just a reminder that the recovery from disaster class is still open. We still have a few more seats left. I'm still keeping it open for locals to sign up. I think I have maybe 5 more seats left with about 13 pending out of county. Finishing up the grant cycle for 2023. Being a regional meeting in October and working with public health and animal control for animal shelter plan.
okay, thank you. Any questions for Nicole? Go ahead, Mr. Peters.
I just was going to ask, did you receive my application? Thank you.
And how many places you got available yet?
5 or 6. There's 24 seats altogether.
Okay. I was asked for me to be put on there, but I'm not sure how to do it. Okay. All right, if there's no more questions, we go to Child Support Department. We don't have no report. Okay. Number 14, Emergency Services. Mr. Fremmel?
Yep, as you can see, our call volume is up still, even though our runs for September were a little bit down. Transfers are still, 5 in Ladysmith, 2, because we're still a little short-staffed to be able to commit to transfers. Although we do have people in the paramedic class, so when they graduate, they'll be able to fill some of those voids. As you can see, I got our call volume broken down by township, and that's year to date. And then also we reformatted our reporting software so we can track the Narcan use and who it was given by. When we say unknown, that just means that we didn't, nobody told us if it was law enforcement, a family member, or bystander, so we can't just give a tag to that. But you can see that 14 cases so far, plus I know of at least 3 or 4 more before since this report was done that, Narcan was given. We're going on with the EMR class in the Hayward High School. That should be We've been got still 10 kids that are still doing it, and hopefully that we can get them out into the community with a EMR license, and hopefully they can help their community out, and then maybe we can push them into becoming EMTs, and then they can help me out. I'm working about, this is deaths by age right now. You can see it's about 120 deaths that we're at to year to date. That's to include cremations, so they're not all investigations. As far as that goes, our budget, as far as the medical examiner goes, year to date right now, I've used about 64% of my budget. As far as the budget used for the ambulance, it's around 53%. You can still see from September through August, we're averaging 170 calls a month from 22 to 23, and the average bill is up, which is really good. That means that the billing company that we went with is collecting more money than the one that we had prior. As far as percentage wise, we're about 39%. But we are most likely going to be receiving some Medicare and Medicaid adjustment payments coming up near December. So that should boost that up too. So.
That all you got?
Yep.
Okay. Any questions for Mr. Frommer? Mr. Weaver, have any questions?
No, sir.
Okay. All right. Thank you, John. Number 15, Criminal Justice Coordinating Council update. Andy?
I think the CJCC last month actually reflected a lot of what we talked about at public safety last month. A lot of discussion on mental health needs within our criminal justice system and especially in the jail. So we discussed that because of the incidents that we have and the clientele we're having in August and September. In addition to that, this update on recovery court, which is what we'd be calling our drug court, is now that we have the second judge. They're moving ahead on that, so it's operational and taking in participants effective January 1. Did some review of the deflection grant that the Sheriff's Department will be getting to prepare officers to handle the drug cases, essentially when they identify them in the community. And then, like Lynn said, Judge Isham joined CJCC, so it was a lot her getting up to speed on the things that are happening there.
Okay. Good deal.
And we're preparing the TAD grant application for recovery court. That process is underway now to apply for next year. So we're working on that at the present time.
All right. Great. Thank you. Any questions for Andy? Mr. Weaver, got any questions for Andy?
No.
Okay, thank you. Number 16, future agenda items. I guess I don't know if we need to put that Draper Communications back on, or what do you think, Mr. Peters?
As far as I know, everything is things have improved. There has been one comment that with the improvement coming from the tower at Draper, that it's difficult to receive communications from other towers, at least with the pagers I don't know. I have no idea what the reason for that is, but I don't think there's anything new that I would have to bring forward.
Okay.
And I just want to maybe add that there was some additional work done, so there's been improvement, but there was also the plan to install some additional equipment on the winter water tower, and we have essentially called a timeout on that until we have the RFQ process done to see where we're headed long term with the radio system, rather than spend more money on equipment now.
All right, well, we won't put it back on there at this time. If we always need to, we can add it back to the agenda. So, all right. Number 17, correspondence reports from conferences and meetings. Anybody have anything that they want to report? If not, we have no more business. We are adjourned. Thank you, everybody.